Here's a short tutorial on using the Sanford guide, the paper version. If you have the computer or online version, it's pretty intuitive. You don't need a decoder ring to work with this paper guide. However, the small pocket version, which is great because it is a pocket version, does require pretty good reading glasses and sometimes even a magnifying glass to read the very small font. I'm going to use my 2014 version. It's pretty beat up, as you see, and you'll see lots of page markers, etc. The principles are the same for any version of the Sanford guide, including the 2015 or 16 if you have that. Of course, there's a table of contents at the beginning, and this is a book of tables. So you will see throughout the book that you are looking at tables. The second page gives you the abbreviations that are used in this book, and it's really important that you know where this is and refer back to it in the event that you can't figure out what it is they're telling you to do in terms of therapy. In order to fit everything into this very small book, they had to use a lot of abbreviations. So this is a really important place to know where to go when you're getting stumped. I always start at the very end. Of course, look in the index, and it can be done either by body part, like this example which I'm using, which corresponds with our lesson today. Here we go. We can find ear infections under E. Or we can go by disease. We have otitis media also in the index, and we can find out that on page 10 and 11 are going to be our primary areas of interest. As you look up each topic, you'll see a number of pages identified, and in those, the dark one is usually the first one to go to. The bolded type is the first page to go to. You'll notice throughout this slide set that I actually put little markers on the pages that I use most frequently. So table 1 is your go-to table. And this gives tons of information. And it really is the place that you go to when you say, I know I have a person with X problem, infection, and I need to find out what medication I should prescribe. Of course, you've already gone through all the steps of figuring out what the infection is and making a clinical decision, and therefore you have come to a place where you're trying to figure out which organisms are you trying to tackle and which drugs will tackle that organism. So this is a nice quick guide. I always start to the left, in the left column at the top with the who. In other words, what kind of patient do I have in front of me? And in the case of our otitis media, there is a demarcation between age groups as to how we're going to treat these patients. And often in other situations, such as community-acquired pneumonia, as an example, which we'll talk about next week, we see cases where certain profiles of patients are going to lead us into different decision-making about antibiotics based on the fact that different organisms are responsible for their disease. So first is the who. Then I look at the what to see the causative organisms. Now, that might be a bit of esoteric information most of the time, but you'll see why in a minute. That can be very important in the event that the patient either is allergic to or cannot afford the antibiotic regimen that has been recommended. Then on the next column, you'll see basically how to actually treat the patient. What antibiotic choices, and here's where your abbreviations come in handy. I then, and it will tell you here what regimens are recommended for first line or primary, and then you have alternatives in the event of allergies or intolerance to the medicine, or again, sometimes in terms of cost. So if I then skip my eyes down to the bottom where it tells me my dosing, because that top part just tells us which antibiotic based on the organisms. The bottom part, at the very bottom, for our dosing, tells us how to actually dose for these certain problems in populations. Last but not least, far to the right, there are other information here depending on the disease or the problem and the antibiotics involved. They will give you a lot more detailed information. So I mentioned earlier that sometimes it is not just an esoteric exercise to understand which are the causative organisms for the various diseases. Besides, of course, being important for knowledge on your certification exam, this will be some of the things you'll be tested on the common infections which are caused commonly by certain organisms. So, for instance, in the case of our otitis media, as we will discuss in the lecture, we have a causative organism being prevalent there, Strep pneumoniae. And this is not strep throat or group A beta hemolytic strep, it's Strep pneumoniae, which is a respiratory tract problem. So we look at this last table for, there's lots of tables in the book, don't get me wrong, but this is one I tend to have a tab on, as you see, because this is where I'll go if I'm stumped in terms of how could I alternately treat someone who may have allergy, or again, if cost is an issue and the primary treatment or the preferred treatment is not great in terms of cost, or if they're allergic. So here I see, oh boy, there's Strep pneumoniae. It's the second one on the line, and we're looking at, it is one of the gram-positive organisms. That again is, kind of, well, that's interesting. We're not going to be in the microbe lab staining these organisms, but it's good to know that certain classes of drugs are more effective with certain groupings of microbes. So in this case, we see a table that tells us where we might get the best effect and where some drugs aren't going to touch any of the infections caused by this organism. So you want to be sure to understand the key at the bottom, which tells us your susceptibilities and how this drug might actually affect the problem that you are treating. So that's the end of this tutorial. I hope this has helped you take a look at your small book and use it most effectively.